little bit of what you all should be trying to do as a journal reviewer for this. So your job is not necessarily to make the final decision. There's usually going to be a couple peer reviewers to an article, and then it goes up to an associate editor to make, or an editor to make the final decision. But your role is pivotal because you have to critically analyze the paper, provide your expertise. A lot of times journals will ask you what particular areas you feel most comfortable with, and give your judgment and also your opinion about how important the work is for the medical community in general and also for that particular journal. So very relevant for ours. If we're getting a lot of basic science submissions, they might be wonderful research, but we might have to suggest that they go to a different journal. So some basic questions you should ask yourself. Is the paper good enough to be accepted? So, and it might sound like something that's very basic, but the research can seem that well thought out. It can you can enjoy reading it. But if you think that there's serious methodologic problems with it, then you have to give that opinion. And how can we improve the paper to make it the best paper that it can be? So whenever we're analyzing any of the papers that you're going to be looking at, you always want to try to make the paper better. So think about, if you were designing this study, what would you like to see in it? And we always try to frame these comments in a non-judgmental, non-critical way because for any of you who have done research, it's a lot of work. So people spend a lot of time on this, and it can be, people can take it very much to heart if they're getting very critical responses. So always kind of frame it in that constructive feedback way. So when you're first approaching an article, rather than just reading it from start to finish, it's often helpful to read the map. So get some landmarks in the paper, and a lot of times they end up being figures, diagrams, graphs, and usually kind of perusing the abstract and looking at the conclusions. So once you know where the article's frame of reference is, that will help you to go back and then analyze the article, and you won't be wasting time reading through the entire thing twice. And allow time. So most of the time when you get asked to review a paper, you'll get an invitation, and you can decline that invitation. So if you have exams coming up, if you have projects that are due, it's okay to decline it. It doesn't mean that you won't be asked again, but it does usually take a good couple hours to really do a thoughtful review on an article, and you want to do justice to that review and be courteous to the authors. So give yourself a couple weeks. And whatever baggage you have regarding the subject, regarding the author, try to leave that at the door and be as non-judgmental as possible. Of course, there's been a lot in the news with implicit bias with Starbucks, but it's obviously implicit bias is something that we just had a grand rounds on. I think it was last year at the medical school. So it's something to always be cognizant of. And conflicts of interest. Now, this is going to be particularly relevant for us just getting started as a journal, because you'll know potentially a lot of the people who are submitting to the journal. That doesn't necessarily mean it's a conflict of interest. So a conflict of interest might be if you're actively doing research with the same people who are submitting that article. If you have something to gain, whether it's financial, whether it's personal, maybe you think that if this article gets published, then maybe your article will get published. So it doesn't necessarily present a problem. But if you think that there's going to be a problem, it's always soundest to present that concern to the editor or to the associate editor and leave it up to them to make that final decision. It could also be if you have a contentious relationship. So if there's someone that you really don't get along with, that's something that you should report to the editor as well. And you can't like everyone, can't agree with everyone, so it's completely acceptable if you need to make that known. It will not be disclosed to the authors. So all of this is a confidential relationship that you engage in once you agree to be a journal reviewer. So what's not a conflict of interest? So if it's a classmate, if it's someone that you just kind of informally talk to about the research, if you have past collaborations but you're not actively working with them, a past mentor. So like for example, if you had someone that you were working with in FMP and now you're a third year and you're no longer working with that person, it's completely acceptable to still review an article from that author. And again, if you're ever not sure, just contact the editor. So unconscious biases, the implicit biases. Author bias, sometimes there will be a double-blind review, but more and more commonly, the reviewer will be anonymous, but the author or authors will be known to you. So you may have a bias against that particular author. You should always ask yourself the question, would you still have the same thoughts, the same criticisms if a different author did it? Or same thing, you could change any of these. If a man or a woman wrote it, if it was from a different country. So always, if you find yourself on the fence about something, just change that and see if those biases would still hold up. Prestige biases is very well known. If you're getting something from Harvard, Stanford, Oxford, a lot of times, you may have a tendency to disregard or kind of like brush under the rug some potential methodologic problems, and you just assume that they were doing the best research possible. And model bias. This is if there's a given, say a given medical condition. We can talk about CHF, for example. So if you're approaching it from two different angles, then you're in one camp and the author is belonging to a different belief system, a different camp, then that in and of itself could potentially bias your review, either positively or negatively, of that paper. And the positive bias is another very, very known phenomenon whereby papers that end up with good p-values, like that 0.0001 p-value, ends up getting published, and negative studies don't get published. But the negative studies are still very important. It can still advance the cause of science. So you always have to ask yourself more about who's going to be interested in these results, rather than just simply what the p-value is, or whatever the confidence interval, or whatever the statistic is that's used. So we kind of talked about this, just, again, just switch whatever the author, country, institution result is, and see if you're going to have the same criticisms after you do that. And when you're doing feedback, again, make sure that it's always constructive. If you're too negative, there's a very good chance that the editors or associate editors will just disregard your comments. They really want to see that you're doing this thoughtfully and that you're approaching it with an aim of trying to improve the research and not just tearing apart a colleague's work. So think about what could be missing, what questions you have when you're going through the research. And again, be kind. So this is my kitty professional picture, because it had to be a gratuitous kitty picture in there. So if you say things like it's ridiculous, like this is a waste of your time, just don't do it. If you're thinking about capitalizing anything, don't do it. I mean, the White House may have different views, but just don't do it. And you may not be invited to review in the future as well. Just keep it professional. And try to avoid the vague criticisms. So be very specific. So so say on line 39 of page 6, the authors need to include a reference for this statement, or that that this particular arm of the study had an inadequate control group, and it would have been strengthened if they compared it with this type of control group. So be very, very specific in your comments. And don't worry about the typos, because journals will have editorial staffs that will go through all those typos. So don't waste your time on that type of thing. Make it, if you don't understand the English at all, that can be a concern. You can definitely make comments about that, but the little things you can just, you don't have to delve into. And the confidentiality. So as soon as you get an invitation to review an article, you're engaging in a confidentiality agreement. So you can't disclose to others that you're reviewing this article, that these authors are doing this type of research. Even if you decline to review the paper, that information is still kept confidential. So just be aware, and you shouldn't even be like, if it's like your friend, you shouldn't even be telling them that you're the one who's reviewing that work, because it can definitely come back to bite you. Like, what if it gets rejected? So it might be a little uncomfortable.
Do they ever find out who reviews their articles?
Not unless, I mean, it's just like with the reviews that you do, evaluations that you do, unless you do something very specific and you say, like, oh, when we were in ALG on February 2nd and we talked about this, so as long as you are sufficiently nondescript, they will not know who is reviewing their paper. Oh, yeah.
We're doing only single blind for this journal, so you're going to know who the authors are, but they're not going to know who the reviewers are.
Right, I remember reading that, okay.
Yeah, and we never disclose that later. I mean, sometimes, you may be asked to re-review. If you ask for comments or you ask for revisions, sometimes you may be asked to re-review that same journal article, but you still won't be, they still won't know who you are for that revision either.
But they might know who's like in the category that they're publishing it in, right?
There's like something like 30 potential journal reviewers.
So you're not just doing ones for your area? You know how like some are split up to different groups?
So again, unless you make that known, unless you say, like, I'm only going to be looking, like, unless you broadcast to your classmates, I'm only going to be doing, I don't know, like
I just thought that
underserved
was, like,
areas.
So there's a greater chance that you would be one of the ones if you're a student editor. So there's student peer reviewers, and there's also the student assistant editors who are going to have slightly different responsibilities.
Okay.
So it's possible one of the student editors for that type of paper could serve as a peer reviewer, but not definitely. So you're right in that a person might think there's a higher chance. If you're, for instance, if you're one of the student editors for historical perspectives, and your classmate might think that there's a higher chance of you possibly being a peer reviewer, but it's in no way guaranteed.
Right.
So we're like separate than the peer reviewers in that
Yes,
regard.
but
This is more about peer reviewers.
yes, but some of the student editors may conduct peer review,
Got it.
so
Okay.
it's definitely something that you would want to know about too.
I was just trying to clarify.
Sure.
Right.
It's a little
No,
confusing.
it's a good question. And you want to think about the significance. So again, you might find some of these studies interesting, but you have to think about the significance to the overall medical community. So obviously, if there's something that's very pressing, like we're going to talk about an example with medical readmissions, that's very important for the medical community. So you might want to think about maybe weighing that higher than something that's very specific to like a very, very small subpopulation, and it may not affect as large a population. So consider the impact, and then if you're looking at something and it seems interesting and they're using a large data set, you always have to worry about the salami slicing. So that's where authors are trying to get 2 or 3 publications out of one data set. So like they might ask one specific question in one article, and then ask a different, spin it a little bit for another article and submit it to all these different places so that they can just like bolster their CV. So just be aware, if you have concerns about that, you should reflect it in your comments. If you think that article is not enough as a standalone article, then that needs to be a comment. Anything that you really have concerns about, it's okay to bring it up. We'll go through how you would delineate major and minor concerns. And then assessing the significance. So you want to think about, are they using the most appropriate methods and instruments? Some of this requires that you do your background research on this. That's why you have to allow that 2 to 3 weeks to complete this, and you have to allow a few hours, because you have to do your own background literature search. You have to know a little bit about the field yourself, because otherwise you won't know if the type of methodologies they're applying are correct or completely, out of left field. So are they using the most up-to-date instruments, methods? And if they're not, sometimes you won't necessarily have a psychometric that's going to answer your exact question. So if they're coming up with their own psychometric, what have they done to validate that tool? Or do they have any other support for using a tool like that? So again, just go into this, and a lot of times there's still articles that would be published that don't provide necessarily that type of rigor. But we want to try to aim for the highest quality, so that should be listed as a concern.
And when you are doing some background research, you can reach out to the library.
Oh, yes.
Assistance.
Yeah, absolutely. That can be a big help, especially when you're busy doing other things. So the scope of the journal, so you may end up reviewing for different types of journals, so it's important to know what their exact areas, and I'll do this when I review for journals all the time. If I think that it's an interesting study, then I like, for example, I review for critical care medicine. There are some very interesting things that I've come across that it's not fit for a journal of that depth and breadth and acuity of patient population. So so I might suggest that they publish in I'll give them 2 or 3 other options for journals that they would consider. And that's completely fine. So this is just taken from our own bylaws of this journal, so that you're aware of the type of pieces that we're looking for. So the review form, and I have a few. So the first couple pages are just some comments and kind of boiled down versions of what this whole talk is, and also some questions you can ask yourself when you're going through a review process. The third page is what the review form is going to look like. So a lot of these review forms will have some commonalities. You'll always want to, at the end, decide if you're going to accept it with minor changes or major changes. And again, that doesn't mean that it's an automatic accept. It means that they have to resubmit it, and then you have to, again, give your approval that you actually accept those changes that they made. Because if they just do cursory, like cosmetic things to it, and they don't substantively change the article, it's okay for you to still reject it, even if you initially said, accept with major changes, or just, reject flat out. Sometimes some journals will also have a numerical rating system for for where you put that manuscript. We didn't do that for this, but and then there's some Likert scale questions going through the originality, the statistical analysis. If you have concerns, if you recommend another biostatistician looking through the work, the length, things of that nature. The bulk of it, which doesn't seem like a lot on here, but it's going to be the bulk of it in your review, is the comments to the author. So, we'll go through some examples here. This is a retrospective review, just because I thought probably initially you guys will be seeing a lot more of these type of chart audit, chart reviews, things of that nature. So it's always good to first provide a summary. You're not commenting on the article, on the validity of the article, on the methods. You're just summarizing what took place. And you're also trying to put it in a context of who is going to be interested in it, what specific questions is it answering. So for this one, they're saying it's a retrospective review of risk factors for hospital readmissions and ER visits among a medically underserved urban population after CHF admissions. So the authors know that you actually read it, the editors know that you actually read it, and then it targets, you go into a lot of the more specifics, and then say a little bit about what's good about it, what's different about it. So so maybe it addresses a very specific, timely concern. It expands the current literature on a specific subpopulation. So you want to say where is it filling in holes potentially. And then you go through the major and the minor issues. And again, it's always good to keep it organized. I have seen reviews where people will just kind of write everything out in stream of consciousness, and that gets very confusing for editors to sift through later. So try to kind of go through everything numerically. And I think this is actually an older version of I added some other things to this book afterwards, but so you should say things like if they should refine the diagnoses for which the patients were readmitted, like are they counting all readmissions? Are they counting readmissions for CHF in one category, readmissions for medication misuse, for COPD, for infections, for syncope, all those other things in another category. So these, just thinking as a clinician, what kind of answers would you want to have after reading this article? Sometimes you'll see things that like numbers won't add up. Sometimes you'll see they'll have these categories and it won't equal 100%, or the statistics will be done incorrectly. I'm not suggesting that you redo all of the statistics, but if you have concerns, it's okay to just send it on for the biostatistical secondary review. You can talk about the tables. I mean, the tables and graphs should be one of the highlights, and it should be something that kind of draws you to an article. But if you're seeing that like they're cumbersome, they're hard to follow, then it's okay to point all of these things out. You want to ask if the research is novel. Again, that's where the literature search is going to help. I mean, if you're seeing something that, hopefully you don't see anything that's completely plagiarized, although it has happened before. But is it answering something that's really a new question? Is the audience of this particular journal going to find the topic interesting? And again, we're not aiming for basic scientists. We're aiming for PCPs, for ER physicians, for hospital practitioners, maybe for sociologists. And then you want to know a little bit about, are the conclusions actually supported by what the data, by the data that they've given? A lot of times, if you read the conclusion section, there'll be these broad, sweeping statements, and if you actually go through the data that they presented, it can't be supported. So they may have to be a little bit more circumspect in what their comments are. It doesn't mean that they have to throw out the entire paper. And then, is there enough experimental data for you to actually reproduce this? And we'll go into some of the inter-reader reliability and things of that nature. You might also want to go through the corresponding author's prior research. Again, make sure that they're not kind of quoting themselves a lot, that they're not just doing a twist on other papers that they've submitted to other journals. So if we go through, again, a little bit more for a retrospective chart audit, which is probably going to be some of the things that you'll see more commonly. You're going to see it a lot in epidemiologic studies, in evaluation research, in QI, so a lot of what this journal is potentially going to be aimed at. And it is generally quick. It's generally cheaper. I mean, no research is really cheap, but comparatively speaking, it's less labor intensive. It's good if you're looking for relatively rare events, like in the example of the CHF readmissions. It's not going to happen to every person with CHF, so you're able to limit your population a little bit. So you have to think, even just from the first step, is this type of study design valid for the endpoint that you're looking at? So if you're looking at something like hemoglobin A1C control in a large population, that's going to be a more frequent event. So maybe doing a random sample would be, and something prospective would be more valid than doing a retrospective chart audit. So some of the limitations you have to think about, and again, you want to see if the authors are commenting about these limitations. I mean, limitations are going to exist with every type of research that's out there, but you want to see that the authors have actually thought about these limitations and have addressed it. And usually the limitation section will come in the penultimate paragraph before the very last conclusion. So you want to see, did they talk about the potential for selection bias, the potential for For instrument change, if they're looking at something over a 10-year period, maybe the instruments and the gold standards have changed over that time period. The researcher bias. You know, if you only have a couple people doing these chart reviews, how are they trained? What is their bias? So all that has to be looked at. The generalizability. You know, if you're only doing if you're only looking at Cooper, is that going to be generalizable to Illinois? So you have to make sure that those type of things are addressed. And I have the website down at the bottom. They actually go through a very nice scientific approach to retrospective chart reviews. And again, I don't necessarily expect that every article that you review is going to lay all of this out in this kind of detail, but you would like to see that there's some type of serious methodologic approach to it, and it's not just random. So does it seem like there was a question that was clearly stated, ideally in a PICO type of format? Have you guys done PICO? And okay, so you want to see, you know, can you fit it into a PICO format? Was the goal and the hypothesis actually stated? Is the chart information able to answer the clinical question? So you know, if you're just getting ICD-9 codes or ICD-10 codes, that might not be sufficient to give you the nuances, to the little bitty details. Like if you're looking at readmissions, and maybe you're looking at creatinine and, you know, and AKI in people who are coming back in with CHF readmissions. So if you're just doing that and all you have are ICD-10 codes, it's just going to be labeled as AKI. So you're not going to know, is that a creatinine bump of 0.3 in 48 hours, kind of like a textbook definition, or did these people end up on dialysis? So that may not necessarily give you a clinically relevant answer to your question. And you know, and it could potentially look like a very nice, well-done paper, but if it doesn't help you clinically in the real world, then you know, it has to be addressed. So if you ask, for example, a general clinical question, what's the best method to decrease readmissions for CHF in patients with no insurance? And again, this is just an example. You try to fit this into the PICO format. So you're saying they have to be over 18, they have to have a diagnosis of either systolic or diastolic CHF, and they have to be listed as self-pay, no insurance. There's a whole lot of different categories you could potentially come up with. And then the intervention, you could say, you know, is it going to be a nursing intervention? Is it post-discharge calls? Is it social workers? Is it, you know, outreach? What exactly type of intervention are you looking at? For the comparison, you could, you know, compare it with, you know, if people are going to discharge clinics and see if there's going to be a difference in readmission, and then the outcome, obviously, readmission. So when you're generating, or when the author is generating these research ideas, you want to think about what the research goal is. So is it just to describe something? Do you want to try to make an association between two different scenarios? Are you trying to actually predict which CHF patients are going to be coming back into the ER? Are you trying to compare maybe, you know, preserved DF with reduced DF and see if one group has a higher likelihood of coming back into the emergency department or being readmitted? So that research goal should be delineated. That's just the same thing again. The literature review that the authors do is also very important. So if they're just diving right into their methods, you want to know that there's a little bit of background. Even if you're an expert in CHF and you're an expert in readmissions, you want to know that the authors have done a little bit of background research and that they're citing the most relevant articles for the field. If there's, you know, an article that just came out that wasn't cited, I'll sometimes include in my comments that the authors need to include this particular citation. And then review, so what's known, what's been studied, how and why is the patient sample defined the way it is, very important. What are the commonly reported outcome measures? So, and we went into that a little bit back here when you're talking about, you know, like what exactly are you comparing, or, you know, are you talking about AKI, are you talking about rates of ending up on BiPAP? What exactly are you looking at for your outcome? And then the methodology, and again, their limitations. This is a kind of nice little mnemonic when you're approaching a research article for finer. So Is it feasible? So is the study feasible? Is it interesting? Would it be interesting to you or to your colleagues? Is it novel, or does it just kind of resurrect the same research that's already been done 10 million times? Ethical, obviously, and relevant. When you're going through the actual methodology, I can't tell you how many times I've looked at papers where they haven't given a sample size analysis. So incredibly frustrating. It's like the easiest statistic to calculate, and a lot of times it just won't be mentioned. So, like, how did they come up with needing 50 patients versus needing 250 patients? So you want to see that all of that is laid out, and you want to see some kind of justification for the sample. So is it just a completely random sample? Are you saying from June 2016 to June 2017? Or are you doing something a little bit more sophisticated, like saying, okay, well, every 5th patient who comes into the ER is going to be analyzed. So all of that should be detailed. And then you want to know how exactly was all this information extracted. So, and what kind of training did the data extractors have? Because there can be a learning curve. If you're doing chart audits or chart reviews, there's going to be a learning curve for what how you approach the data, and you may even start to analyze things differently on your 50th chart versus on your 5th chart. I'll skip over this, but there are sample size tables and analyses that are methodologically valid. Again, you just want to see that detailed in the article. And for all of the talk about some of these different types of chart reviews, there's actually not a lot of research on the methodological research. So again, you just want to make sure that the authors are addressing it. For the data abstraction, they should say if there's a couple people who are extracting the data, there should be an inter-rater reliability coefficient calculated. That's a statistical measure. So if you don't see that, and you know that 2 different data abstractors are working with the same data set, that could be a problem, because if one person is saying that everything's in like the 50th percentile, and one person saying that the same exact data is in like the 90th percentile, well, there's a problem there. So you want to know the inter-rater reliability, and you also want to know the test-retest reliability. So if person X is given the data on Thursday, and then 2 weeks later they're given the same data, do they come up with the same answers? Are they extracting the same type of data? Again, it's not very commonly detailed, but these are things that should be there and you should be critical about. And then some of the other things, probably the data cleaning and coding. So, again, like you don't have to go through all of this yourself, but there should be some type of mention of, what was the process for going back through duplicates, through typos, through cleaning up the data and validating the data that they actually had. So, a lot of things that you may not think about as a casual reader of a journal article, but as a reviewer, you have a much higher level of responsibility. So in general, after an article is going through the editorial process, it'll go through the editor, the associate editor, and then it's going to be distributed out. If it passes the associate editor review, because they may decide just up front that this is not going to be worth your valuable time in reviewing. If it passes by the associate editor, then it'll go to you for your journal review. You'll send it back, and then the editor will usually compile 2 or 3 or however many journal reviews are required for that article, and they'll come up with a compilation. It's usually going to be, not just accept or reject, but what the editor saw as the major limitations in the article and what they would like to see. And then usually in the response, the editor will also include all the comments, all of your comments, like word for word. So it'll say, reviewer 1, and everything's just going to be cut and paste. Reviewer 2. So, and you as a journal reviewer should look at what your colleagues have written, because sometimes it can be very instructive. I mean, sometimes I've learned interesting things from other people's comments. So, it's a learning process for everyone involved. So again, which is why you want to pay particular care to your reviews. So closing pearls, take your time, be polite in your comments, try to be as impartial as you can, be very specific, by line, by, exactly what you think needs to be fixed, do your homework, and again, keep everything confidential. So that is all I have. I'm happy to take questions about anything